This presentation gives an overview of some of the things you might like to bear in mind when preparing your assessment for the module Adopting the Role of the Registered Nurse.
So this is the last piece of academic work you've got to do before you register, and it probably seems like a bit of a hurdle. You're probably spending a lot of the time thinking about registration rather than writing your final essay. But bear in mind that this is a good chance to show how far you've come. It's very much about the registration process and about the real life of nursing. So use that as a motivation to keep you going. The assessment involves choosing an aspect of your clinical practice and reflecting and critically analysing your professional development by drawing on supportive evidence from your portfolio.
Though you've been asked to talk about your experiences and the learning that you've undergone in clinical placement, it's important to remember that all the usual academic conventions apply to this piece of writing. So make sure that your essay has a firm structure to help keep you focused, and also read widely and make sure that you use a combination of evidence, so different types of policy documents, research and journal articles, as well as referring to your own portfolio. And do make sure that you take a critical and analytical approach to everything that you do within preparing your essay. You've been asked to focus on one aspect of your clinical practice and the learning that you've undergone as part of developing your professional expertise in this area. Make sure you choose it very carefully and that you're comfortable in talking about the area of clinical practice so that you can give a rich description and justify why you've chosen this particular area. It's also important to relate it to professional development, so what you've learned so far and what you hope to learn in the future. And in doing this, you'll be using evidence from your portfolio to demonstrate that development, not just referring to page numbers, but actually using your action plans and different documentation that you've collected over your time and placement to support the argument that you're building.
The module handbook gives really clear guidelines on what the markers are expecting from you, so do use those. It's very easy to be sidelined, to have a good idea of the overall topic but forget the specifics of what you've been asked to do. You can end up writing the assignment that you want to write or that you think you're to write when actually you've gone quite far off track. So keep the guidelines around you and keep turning back to them to check that you're going down the right path. You're also given detailed guidance as to the structure of the written assessment. So within the introduction, you're asked to identify the area of practice and also identify which model of reflection you'll be using, and also to provide a rationale for those choices. So why that particular area of practice? Why is it significant to your development? And also provide background information for the reader. So the introduction is where you set the scene.
The main body of the essay is where you have a chance to reflect on your progress and learning so far, and also engage in a critical analysis of your own professional development by using a variety of different resources to build an argument. Here is where you will be comparing and contrasting nursing theory, best practice and research with your own experiences, and using that to substantiate your argument and the points that you make. This is also where you'll identify and explain the evidence that you use from your portfolio, and also make recommendations for continuing development, so how practice and healthcare could be improved from your own experiences, and locate that within the wider contextual literature. Then in your conclusion, you're going to be bringing all your main points together and summarising the key issues that have been made within your argument for the reader. There's not necessarily going to be any new information here, it's just a summary for the reader of what you want them to take away from your written work. After the conclusion, there will be your full reference list, where you'll have a compiled list of all of the resources that you've used in alphabetical order. And then finally there's your appendices containing all your clinical evidence. We have a leaflet on how to incorporate these into your writing, so it might be worth having a look at that whilst you're planning your assessment.
The final piece of advice we would give is to pay close attention to the marking matrix. So be aware of how the piece of work is going to be marked. Have a look at what's a fail, what's a pass, what's a good and what's an excellent, and try and get towards the good and the excellent criteria. But if you've got any issues with this assessment, do get in touch and we can offer you one-to-one support.